everybody. I wanted to get on real quick and talk about a condition that a patient presented to my office with last week, Friday. And so it's called giant cell arteritis or temporal arteritis, right? And the reason why it's important is that there is a risk that there can be some vision loss. So my name is Dr. Arinola Dada, and I help people with autoimmune disease or joint pain become pain-free and get their immune system back on track. So the patient I saw last week, Friday, I got a call, it was about 3 o'clock in the afternoon, from an ophthalmologist who said, "Hey, Dr. Dada, I think that this patient that was sent to me from the emergency room may have temporal arthritis." Okay. So backstory, I end up seeing this patient 2 hours later in my office, and it's 5 o'clock on Friday. And the reason I made this happen because I was very afraid that he was going to lose his vision. So this patient apparently 2 weeks ago was doing well and then developed pain in his jaw. And he described it as pain when he was chewing, and that each time he chewed, he'll just have worsening pain. So he thought this was very severe TMJ pain. And so he decided to go to the emergency room. In the emergency room, they examined him. They called in a TMJ specialist. They couldn't figure anything with his jaw and sent him home. The next day, he developed double vision. Smart man, he decided to go back to the ER. And at that point, they were like, okay, let's talk a little bit more about this TMJ pain you're having. And so they figured out that he was having tenderness and headaches. Actually, that had started because he had this TMJ. He was very distracted from the fact that he was also having these headaches. So he was having headaches, and then they found that his scalp was really tender and that he was having double vision. Hence, the referral that they did emergently to see an ophthalmologist, the eye specialist. And the ophthalmologist saw him and said, no, this is temporal arteritis or giant cell arteritis, and he needs to see a rheumatologist ASAP. So because he presented atypically, right? Usually it's a headache, you have a low-grade fever, you have sometimes something called some PMR symptoms where you're having stiffness in the morning, difficulty getting in and out of a chair. He didn't really have those. He really presented more with this jaw pain. So I thought, well, maybe let me make sure that people know what are those atypical presentations that people could have, right? If they have giant cell arteritis. So let's go. One, people can present with double vision. Like you can just wake up in the morning, have double vision, and then you can have the headache later. You can actually have a low-grade fever. You can have a fever where they've been trying to figure out why are you having this fever? Nobody knows, and it's actually due to having giant cell arthritis. In fact, giant cell arthritis is a very common cause for fever of unknown origin, right? What else? You could actually have just when you touch your scalp or the hairdresser or your barber is combing your hair, and then he's like, why is your scalp so tender, right? Or you have this headache that you take Tylenol, you take a leave, and it doesn't go away. Or the cramps in your jaw, like not a lot of things give you that. It's called claudication in your jaw. Like the more you chew, the more tired your jaw feels, right? Double vision, sudden loss of vision, right? Vision kind of fleeting, like there's a curtain coming off, going off, coming back and forth. Those are symptoms of giant cell arthritis that people should be aware of. And then on blood test, he did have a blood test done in the ER, which did show that his ESR and CRP, those are blood markers of inflammation, they were high. So by the time I see him on Friday at 4 o'clock, the ophthalmologist had put him on some prednisone 20 milligrams. The good thing about this condition is that it can be treated. It's very treatable. So we can treat it with prednisone. Usually we're going at 40 or 60 milligrams. But the good news is that there are also other medications. They're known as biologics. And so one of them blocks interleukin-6. You don't need to know that. All you need to know is that there's an alternative to prednisone. So for other people, like say, if you've already been diagnosed with giant cell arteritis, right, or been diagnosed or been told that you have temporal arteritis, and you've been put on prednisone, question to ask your doctor is, hey, can I see a rheumatologist? Because a rheumatologist may decide that, hey, the side effects of prednisone are a lot. Perhaps we should put you on a biologic like an interleukin-6 blocker or Actemra that can reduce the side effects of prednisone, reduce the length of time you're on prednisone, and potentially allow you to have a better outcome. So my name is Dr. Arinola Dada. If you know anyone dealing with giant cell arthritis or temporal arthritis, having a tough time, well, have them see me, have them watch the video, or have them talk to their primary care doctor about other alternatives to prednisone. But if you are for the first time developing double vision, cramps in your jaw, low-grade temperature with scalp tenderness, and you get seen in the emergency room, make sure you emphasize to them all the symptoms they're experiencing. I'm hoping that all my patients know that if they have temporal arthritis, they need to reach out to our office. So if you're in the greater Seattle area and you need a rheumatologist, find us at Overlake Arthritis Osteoporosis Center. If you know someone that's struggling with giant cell arthritis, send this video to them, like it, share it. Thank you so much for listening, and Happy New Year, everybody.